This is the HITEC-LA area, LA County only. We ask people to enroll in our services, so that's why we say members only. Enrollment is free. We have a 2-page enrollment contract that allows the physicians or the clinics to opt in for our services or opt out. There's no requirement on them at all. Some of the services are free to members, and most of the services are subsidized to the priority primary care physicians. And providers do not have to be members of LA Care Health Plan. You look at the concentration of these offices here, and it is kind of a daunting task. We're a very large county, and the number of physicians that are out there and clinics that are out there that need our assistance is absolutely incredible now that we've started our work. Most of our staff, our executive director started in July of this year, and most of the rest of us started in late August or later. So we're very new at this. We hit the ground running with a bunch of different experiences, and we're working to set up our programs to help HITEC-LA service the physicians in LA County. The REC services are not meant to replace any vendor processes within the implementation space. The complexity of an EHR conversion, usually coupled with a practice management system change, can be quite challenging for even the most skilled offices. We provide services to plan, implement, transition, and maintain the EHRs in a clinical space. We provide training and support services to assist the doctors and other providers in adopting EHR. We offer information and guidance to help with EHR implementation and give technical assistance as needed. Our readiness assessments help us to identify the practitioners and/or staff that need to attend EHR boot camps to enhance their knowledge base, update their computer skills, or learn how to document and assess their current workflow processes. Each of these types of educational opportunities can make a critical difference in the outcome of an implementation. We were recently introduced to a clinic that was having major issues with their visit template design and build. We met with them, determined their needs, and brought in a template expert who will code over 40 templates within the next 2 weeks so that the clinic does not have to postpone their go-live date for the second time. They were relying mainly on their physician, their CMO, to design all of their visit templates. And there's actually 80 templates that they need, but we're doing 40 of them in a phase 1 for them. And the CMO was going to be the one to go through every one of those templates and answer those 57 data elements on every one of the different types of visit templates that they have. This clinic, even though they had conducted a very thorough RFP process and rigorously vetted their vendors, are still very disappointed that there will still be manual processes even after the EHR implementation. In addition to the template situation, we began discussing other business-critical functions such as internal dispensary reconciliation, daily patient-specific diagnosis-driven public health forms, county immunization registry data entry, and multiple pediatric intervention forms that must be reported to the state on a daily basis. By introducing the concept of a business process software to wrap around their EHR and another scanning and OCR solution for this automatic form conversion into the EHR, this clinic will be able to leverage the technology to drive the success of their EHR and will be able to concentrate on the quality of care that they deliver to their patients. This particular clinic has 77% uninsured care, and they do a little over 90,000 visits a year. The final rule requires that most providers meet a set of meaningful use objectives in order to qualify for the incentives. I say most because the providers that qualify for Medicaid incentives do not need to meet all the meaningful use objectives in their first year of participation. But all providers in the Medicare program and all providers in the second year or later of the Medicaid program will need to meet meaningful use objectives in order to attain their incentives.